My name is Dr. Nuala O'Connor, and I'm the Irish College of General Practitioners lead advisor on antimicrobial drug resistance, or antibiotic resistance as most people would know it. Well, antibiotics are a fantastic and precious resource, but antibiotics are being overused and wasted, and it's a situation which we all need to take very seriously. Every day, doctors in Ireland, in Europe and worldwide are facing situations where they have patients that they cannot treat because the patient is suffering from an infection which is resistant to all known antibiotics. And about 25,000 people die each year in Europe from multi-drug resistant organisms. So it's a very frightening number. And if we, and by we I mean doctors and patients, don't do something about it, then this situation is actually going to get far worse. Well, doctors definitely need to actually improve what they're doing, and well, this is a public information campaign, and it's really about what the public can do. Behind the scenes, there's an awful lot of work going on for doctors as well. Both in hospitals and in primary or community care, doctors through education sources are being made more aware of the scale of the problem that we're facing. We now have clinical guidelines about antibiotic prescribing, and these guidelines are trying to get us to prescribe more narrow spectrum antibiotics rather than broad spectrum antibiotics. So the way I often describe it to people is why use Domestos when fairy washing up liquid will do. Okay, so there are different types of antibiotics outside there. So you have more narrow spectrum antibiotics, which will actually kill most of the common infections that we see. And then we have these broad spectrum antibiotics. And you're all aware of the recent news highlights about the shortage of a broad spectrum antibiotic called Augmentin. But in actual fact, Augmentin is not a first-line drug for many infections that we treat in general practice. So both GPs and hospital doctors need to be more careful, not just about whether they prescribe an antibiotic or not, but when they do go to prescribe it, that they choose one that's narrow spectrum rather than broad spectrum, if a narrow spectrum one is going to treat the patient or treat the bacteria that the patient has. And the other thing I think that GPs need to do is they just need to actually take the time to actually explain to the patient, what is the difference between the virus and the bacteria. Tell patients how long it's going to take them to get better. I mean, a lot of people don't realise that you could cough for up to 3 weeks following a viral infection, that most sore throats are going to take up to 7 days to get better. So there's a lot of education needs to be done on both sides, but really keeping antibiotics effective is actually everyone's responsibility, and that is the key message of this campaign. We can't afford any longer to ignore it. Patients, doctors, the government, we all need to take action now, and that's why you see on a day like European Antibiotic Awareness Day that we have a coming together of all of the key professions in this area. This is a problem that we have to face, and it's something that we have to face as a total community, so that we can preserve the effectiveness of our current antibiotics for future generations. Antibiotics are wasted on colds and flus and a lot of viral infections. We need to preserve the effectiveness of our current antibiotics, and we need to be very, very careful not to misuse them.